I'm just about to see my first patient today. I'm really excited, a bit nervous at the same time, but I've done this before, should be fine.
Hey guys, so it's the 28th of September. We are on the final week of September, which is crazy because it means it's been a month since I've been doing foundation training. Honestly, I don't know where the time's gone. But yeah, so far so good. I feel like I always say that, so far so good. But yeah, no, it's been going fine. Obviously, as you guys know, a bit of a slow start because I needed to get fit tested to get the mask. But that's all done now, so I've got my mask. So hopefully I will be doing some procedures soon. We have to send our certificates to say that we've been fit tested to our TPD, who is the training program director, who's in charge of our scheme. So they approve all the foundation dentists and give them the thumbs up to when they can get started. So yeah, hopefully I can get going. But for now, I am on the way to work and we shall see what this week has in store. All right, guys, see you later. Bye. Alright guys, so I am at the practice, all changed, ready to go. So here you can see an extracted tooth. I had some spare time during the day, so I got to practice root canal treatment. So before doing the root canal treatment on this tooth, I'd managed to take a pre-op radiograph of the tooth just to check if there are actually any canals visible inside the root, which you can see the dark little lines, those are the canals. So then once I established that, I got started with the root canal treatment. So you can see here, I've got my handpiece, I've got my loops, which are really handy when doing root canal treatment because you can actually see what you're doing. And then I've got my educational supervisor, Raymond, who's on standby helping me throughout if I have any questions or anything like that. Creating the perfect access can be a difficult part of root canal treatment. So I asked Raymond his opinion on how an access cavity should be like.
How wide would you open it?
Well, you want how wide? No, you've got to be able to see everything inside. So it's got to be wide enough so you can see all the canals. I think the canals should be able to see some canals. There's evidence on the X-ray to see those canals there.
So in summary, you need to make your access cavity wide enough so you can actually see the canals. So for those of you that aren't dentists or dental students, you probably don't have a clue what's going on. I'd explain a little bit about root canal treatment. In summary, it's a process where we go inside a tooth that might be causing the patient pain, and we basically clean out all the nerves. So it can take multiple appointments. It's got a bit of a bad rep. I think that's because people don't really like the long appointment times. However, I think it's one of the most amazing procedures we have in dentistry. It's very intricate and it's the last leg to saving the tooth. And I always let the patients know that. So you can see here I'm getting deeper and deeper into the tooth because the canals, they're quite deep into the tooth. So that's why it takes so long, because you need to really pay attention and focus because you're working in such a small space. So you can see there in the video that I've got the canals. You can see those little dots at the bottom of the base. If you can pause the video, you probably see. I've got the files. So these are the files that go into the tooth to clean out the nerves. So you can see I'm putting it into each canal just to make sure that I've got it. Ideally, you want a size 10 file to establish your glide path, and then you can use a size 15 just to do a bit of coronal flaring. So yeah, that's me with my size 15, just getting all the canals, making sure that I have them all. Then once I had that, I put all the files, the size 15s, in each canal. The reason I've done this is so I can take a working length radiograph. So what this is, it's basically an x-ray that allows me to see how far down the files have gone at the bottom of the tooth, because it's important for us to know its length. So you can see here I'm taking the radiograph. It was actually quite difficult getting the film in the right place because it was an extracted tooth, but nevertheless I made it work, and I just pretended it was a real patient. So I obviously stepped out of the room, pressed the button, and then I'm able to go back in. So this is how the radiograph turned out. So you can see out of the 3, 1 went to length, 1 was a bit short, and the other one wasn't quite in the right position. It was a little bit over extruded. So this is why it's really handy to take the radiographs, because we can't see directly inside the tooth, so it's really helpful so you can get an idea of what you need to change. So after this stage, what we do is take out the files, remeasure them, and then prepare it all to length and then fill it up from the inside, which is what we call obturation. However, this time around I wasn't able to finish it because I had to go and do other things, but it was good practice.
Hey guys, I've actually had a really interesting morning. I started off by shadowing Sarita. She had a complex endo case, so endo's root canal treatment. Essentially the person's endo failed, so she had to remove the old GP. So what GP is, that's the material that we use to fill the canal. So it's like a plastic material, and after we've removed all the bacteria, we use that to seal the canal and fill it up. So she had to basically remove it with the different files. She used a headstrong file, and then she managed to get it all out. It did take quite a while because it was a 6, but in the end all the GP did come out, and she's going to be seeing him again to continue just treating that tooth and trying to save it. So yeah, it was really good. And after that I done some work with Raymond. So we were just discussing different cases, and then he got me to do some root canal treatment on a molar on one of the extracted teeth. So as you guys saw, I was able to do that. It was really interesting, really quite cool to do it on an extracted tooth. It was a real tooth, so we actually managed to take an x-ray of that tooth, which you guys saw. I'll put the x-ray up again. So that x-ray, you can see the canals, and yeah, so I just basically accessed it and I found the canals. So yeah, it was really eventful. I quite enjoyed it. It's actually 1:30 now, so half an hour into my lunch. I decided to just cut into my lunch a bit to finish off that endo, the accessing and finding the canals. But yeah, I should probably go eat some food now. So I'm gonna go get my lunch, and then we'll see what the afternoon has in store. All right guys, bye.
So I went to go and grab my lunch out of the fridge. That day I had stir-fried chicken noodles, which I was really excited to eat because I get really hungry really quickly, as you can see. But yeah, so now going on to another day. This was a day where I went over some veneers. So I got to practice doing a veneer prep. This is how the tooth looked before, and this is how it looked after. So you can see I took off a very small amount of enamel. I think a lot of people have the wrong idea about veneers, and they feel that a lot of their tooth should be drilled away, and that's not necessarily the case. So you can see here I've literally removed 0.7 millimeters, maximum 1 millimeter of enamel. Then once that's done, I had to make a temporary veneer to go over that. So you can see Raymond's there, always there to help and guide me if I need it. And just, yeah, I did ask him a couple of questions about when we would do veneers on the NHS, because it's not something that's frequently done, and also whether he'd prefer porcelain or composite veneers.
If it's making the patient, if the appearance of the tooth is making the patient very unhappy, it looks really awful. I think that's, I think that's an indication for NHS. I think that's valid.
What about with composite over it?
What composite? a composite veneer rather than a. Yeah, I think that's fine. I think that's fine. The only trouble with composite is, although they say it's reversible, and it is in theory reversible, it's quite hard to tell where the composite ends and the enamels begins. So I think you're always likely to either leave composite or remove some enamel. I think it's impossible to separate them. No, you've been doing a nice job there.
So this was the final result with my temporary veneer. So you can see it almost looks as good as new. So I was pretty happy with that. And this is just showing you how thin it is. So as the name suggests, it's literally a veneer over the tooth. So yeah, it literally goes on and off. If this was a real patient, what would happen now is that I'd take an impression of my prep, and that would then be sent to the lab and they would make the veneer. So yeah, that was that. Then it was time for lunch, and as you can see, we had some pizza. Basically, one of the foundation dentists, it was their last day in the practice, so it was really nice of them. We had a little goodbye meal, we had some cakes as well. So yeah, I definitely had a really good lunch that day.
Hey guys, so the past couple of days have actually been really busy. I haven't really got a chance to properly vlog, but I think you guys saw previously that I did get to do a veneer prep, which was really good. I found that was really good practice because a veneer prep isn't something that you regularly do in dental school, so it was quite good to do that. I've also been in and out shadowing my supervisors because I've been fit tested now. Hooray! I've now got my mask, so when they're doing aerosol generating procedures, I can now go into the room. So sometimes they can have AGPs back to back, and I'm just going in and out. And obviously we've got all that PPE and obviously because we've got all that PPE on, it's quite difficult to just obviously vlog afterwards. But no, it's been really insightful. I've got to do some things here and there, and I think by next week I should be in the full swing of it. Now that I've been fit tested, I just need approval from the TPD, who's the training program director, to say yes, I can do procedures now. So every foundation dentist has to get approval from their TPD before they start jumping into procedures. But yeah, it was also a good week because during lunch we got pizza ordered to the practice. The last foundation dentist is now leaving, so they just had a goodbye lunch for him, and yeah, ordered us pizza, got some cakes, so that was really nice. I do love a good pizza, and I love cakes too, so it was good. But yeah, and now I am just doing some ePortfolio Chronicles, hashtag ePortfolio Chronicles. So I'm just gonna get going with that, and yeah, I will catch up with you guys later. Bye! Hey guys, so it is the 5th of October. I am really excited because today I'm seeing my first patient, finally. I've got some new scrubs as well, which is cute, dark blue, woo. So yeah, we'll see what the day has in store. He's called up because he's in pain, so probably it's going to be a filling of some sort, or maybe an extraction. We'll have a look and see. So yeah, exciting. Guys, so I'm just about to see my first patient today. I'm really excited, a bit nervous at the same time, but I've done this before, should be fine. It's an emergency appointment, so we'll see how it goes. Okay, so I've just finished seeing my first patient. I'm pretty happy with how the appointment went overall. At first, I was a bit nervous and I was just thinking, oh my gosh, because on the notes he said that he was coming in as an emergency patient. He'd been having some pain around his tooth in his upper right region for some time. And yeah, I was just a bit nervous. I was like, oh, what's this appointment going to be like? But when he came, I just went into dentist mode straight away, and it all just came back to me. Just went through pain history, and it actually turned out that he wasn't getting pain from that area anymore. And what his main concern was that he had a retained root that had been root filled, and the crown wasn't there. So he just didn't like the aesthetics because he had a gap there. It was the upper right 3. The 3 is the canine, by the way. So what we done on that appointment was I actually took out a bit of GP, which was the root canal filling material, and put a temporary post in there. So what a temporary post does, it allowed us to build up some composite around the post, which made it look like a tooth again. So it was quite a lot to do in a first appointment, and in the end he did like the results of the filling that I done, and he was quite happy with it overall. He thought it looked quite nice, so that was good. And after we done like a examination, so I checked the rest of his teeth to make sure that they were fine as well. He did have some other fillings that needed doing, and his gums as well needed some more attention. So I just went through some oral hygiene with him, and we made a treatment plan. And yeah, I think one of the things that I've found that's quite different from dental school is just having to make treatment plans like sort of on the spot. Because obviously in dental school you have a bit more time to think about your like diagnosis and treatment plan, but now you just sort of have to get your diagnosis and sort of get your treatment plan. So yeah, I've done that. Obviously you can go back and look at it, and if there are any changes you can discuss it with the patient at a later date, but initially you have to sort of get that done. Yeah, so we went through that, we got that done, the patient was happy with the plan, and I'll be seeing him again next week. So yeah, obviously I had my trainer watching over me the whole time, but his feedback at the end, Raymond, he said it was fine and he thought I handled it quite well. So yeah, first patient out the way, and yeah, probably as the intensity picks up, I don't know if I'm going to be able to vlog after every single patient, because realistically I probably won't. But at least you guys got to hear my feedback from my first one, and I just look forward to seeing the rest. Good morning everyone. So it's another day at the practice, woohoo. Yesterday was a really good day. I actually got to see my first patient, finally. Overall I think it was quite a good experience. Obviously it wasn't the most simple appointment, but I think it's really good for me to have been sort of thrown into the deep end, because foundation training is the year where you actually learn a lot. So the more you actually do, the more you get out of it. So my advice to you guys starting foundation training next year is to not shy away. If you do have like a complicated patient, or you are asked to do a little bit more, do it. Because when my trainer told me that I'd have to do like a post and a temporary composite in order obviously to accommodate the patient's request, I was like, oh, I've never actually properly done this before. But you know what, there's a first time for everything, you know. So I went for it, and in the end the patient really liked it. So overall I was really pleased with how it came out, and it just goes to show that even if you're nervous about doing something for the first time, or you've never really actually properly done it before, it's all about your confidence and just sort of believing in yourself that you can do it. And once you've done it once, you'll be able to do it again and again and again and again. So yeah, I think it's onwards and upwards from here. I'm feeling really pumped, really motivated, and yeah, I'm ready to see more.
Right, so you've reached the end of the vlog. Thank you so much for watching it all the way through. I really appreciate it, and I hope you enjoyed it. If you haven't already, make sure to like and subscribe, and I will see you guys on the next video. Bye!